The domain of the healthcare management and consulting concentration is really an applied domain focused on learning about the healthcare industry as a whole. They get given an opportunity to acquire a different set of skills and competencies related to things like process improvement, workflow redesign, design thinking, the application of digital technology and artificial intelligence to healthcare. They get instructed on healthcare supply chain issues and theories and how healthcare works in terms of the workflows. And so the career paths that can be focused on involve first focusing on consulting, healthcare consulting. They can have opportunities to become internal consultants where they might work for a hospital or a biotech company or an insurance plan as an employee who works on real problems and innovations within that organization. They can work as external consultants where they might be hired to work on projects for various healthcare organizations to help them solve problems, to improve patient care. They will have opportunities, employment opportunities in the area of management and operations. That might include working in administrative jobs in hospitals or integrated delivery systems, doctors' offices, insurance plans, nonprofit organizations, even governmental organizations that are involved in healthcare at the state or the federal level. And then there's also job opportunities in what I would call niche areas that are growing and that are very popular and important to improving patient care, such as issues related to marketing, issues related to quality of care, and also jobs that relate to how do we really improve the patient experience. There's a lot of really interesting and exciting trends related to healthcare management consulting at the present time. Two of the biggest involve the increasing use of healthcare technology and application of digital health tools such as artificial intelligence to improving patient care, making patient care more efficient, more value-based for the customer, and also higher quality. In addition, using those tools to improve access to care for many who may not have appropriate access to patient care is also an emerging trend. Trends related to what I call talent management, which is how to improve conditions in which the health care workforce operates. For example, preventing burnout among doctors and nurses, improving the working conditions for all different kinds of healthcare workers in places like hospitals, long-term care organizations. And then I would say the final really big trend is the introduction of what I call sort of Amazon thinking into healthcare, which is really taking tactics that have been used in retail and in other industries and trying to apply them to healthcare to make both the patient experience better, but also to reduce costs of care and allow more people to be able to access care. In this concentration, students will learn a lot of process improvement techniques, a lot of how to think about redesigning care processes, and how to really look at things from the user perspective, the patient perspective. And so, some of the projects related to that are real world that I can think about are, redesigning a surgical workflow on the part of the patient and the surgeons and those assisting the surgeons to make that surgical workflow more efficient, higher quality, a better experience for patients and for the surgeons. Redesigning a medical office. From the time a patient walks through the door to get a service, whether it's primary care or some other specialty service, what is their experience like from the waiting room all the way through the exam room, all the way to the checkout counter. And students will be able to, when they graduate from this concentration, understand better how to redesign workplaces to that end.